Good morning, and a very warm welcome to all who are joining us this morning for a very important and lively discussion about a topic that is very important to us, which is family planning, but above all, the complexities, but also the opportunities that are linked to the specific context. I am Catherine Marshall, Executive Director of the World Faiths Development Dialogue, also at Georgetown University, and I'm speaking from Washington, D.C. And we are joined today by three remarkable panelists from different parts of the world. So Reverend Father Joseph Ngumbi Muti is the National Chairman of the Interreligious Council of Kenya, and he's joining us from Nairobi. Rona Murungi is the Senior Technical Officer for the USAID-funded Scope COVID project at World Relief. And finally, Ali Kebe, who's with the Sahel Engage project, who's speaking to us from Mauritania. As you heard in the opening video, we are translating this into English et en français. So we also have French interpretation, and the button at the bottom allows you to follow English or French, depending on your preference. And we very much welcome both chat, introductions, etc., but also in the Q&A, questions. You can put questions, and at a certain point in this hour-long video, we will come to those. The extended biographies of all the participants are available. They will be available in the chat, but they're also available online. And the video, this is being recorded, will be available both on the website and sent to all who registered. Let me make some very brief comments on the topic here. Obviously, the first topic is the role that religious communities, but also religious beliefs, religious relationships play in the globally critical issue of family planning. Religious actors are not always fully engaged, and some distinctive approaches are often necessary to engage, to bring in the religious actors in national, local family planning programs. So we're going to highlight with the individual participants here what this theme of context means. So how has the COVID-19 crisis affected religious institutions in Kenya, and what does that have to do with family planning? Some specific curricula on health and family life that's tailored to reach Christian and Islamic religious leaders in several different countries. And a topic that has particular importance: how can religious leaders engage in a meaningful dialogue with the fast-growing youth population in different parts of Africa, but obviously with particular importance, I would say, in Francophone Africa, in the Sahel, where this is very critical. We're planning to run this as a conversation. So each of the panelists could speak for several hours to you, but we're asking them to highlight some very important points in a very few minutes. So we're going to start with a set of comments from each of our panelists, and then we'll dig more deeply into it. So the first question, and I will direct it first to Father Joseph, is what can you tell us about the context where you're working with faith leaders, and what are the issues that you need to consider when working with faith communities, and what are the opportunities, but also the challenges? And I think we can never forget that we're living through this extraordinarily difficult COVID period. So we'll hear from Father Joseph, then afterwards from Rona, and then from Ali. Over to you.
Thank you. In Kenya, we are in the evening hours. So allow me to greet you good evening. For those that are in the morning hours, good morning. I'm humbled to join you this evening. As you earlier mentioned, my name's Reverend Father Joseph Mutie from Kenya as the chair of the Intelligence Council of Kenya. Just a small note that the Intelligence Council of Kenya brings together both Christians, Muslims, and the Hindu community. Well, allow me to say I'm humbled that you considered to get to hear what is happening in the country and the context that we are in, both as individuals and as religious leaders. We are in the context of the COVID-19, which has affected the majority of our engagements in the communities. Allow me here to say there's so much that we have gone through. And I want to thank the government of Kenya and the different institutions that we've joined forces, like the UNICEF, the Ministry of Interior, the Ministry of Health, that has joined hands with the religious leadership in this country and appointed a new an interfaith committee or council that has worked with the religious fraternity during these very trying times. When the COVID emerged, when the pandemic emerged, definitely we saw the closure of different places, especially the church and the mosque and the temple. And that posed a clear challenge to religious engaging the communities, both in terms of addressing issues of health, but also issues that are pertinent to our communities. And therefore, we came together as the interreligious or the interfaith through the Interreligious Council and worked together to see how we overcome such challenge. It posed as an opportunity to bring us together, because sometimes when we look at some of these pandemics, when they emerge, communities tend to get divided. So we came together as a community of faith and began to think through on how to guide the congregants so that we don't lose our people during this very, very trying time. Our mandate was to sensitize the congregants, but also see how together we build a common understanding on the vaccine that was developed. Allow me to say there was the myths about the vaccine. There was also some misconception about the new virus that came, and everybody was truly afraid. Families lost their members, and majority of our people became very, very much afraid of anything that was said, and this hindered, some of the services that were to be provided, not only to the congregations but to the people. And when we are talking of family planning, it needs us to reach to the young, to the mothers, to every other person. But now a concentration was now, clearly focusing on the COVID. So there was a kind of derail in the focus, such that not much energy was put in the family planning issue, and therefore everyone was worried, because we were seeing people die, people getting infected, people going to admitted into the hospitals, and it became a priority in the community. But again, it became also an opportunity for us to think together and work together as religious leaders. So, as I said, we partnered with government, we partnered with different stakeholders like UNICEF, and together we worked as a community. I thank God that His Excellency the President of the Republic of Kenya, Uhuru Kenyatta, felt that religious leadership was very key. So when he called us together, we joined hands and developed guidelines to aid for safe reopening of the places of worship. But again, we also had to work with the religious leaders to see how we comply, how we help in getting to see how people can comply to these guidelines. It was not easy. On the other hand, when it came to the issue of vaccination, there was also the fear, and every other person, was also concerned. What kind of a vaccine is this? So we came in and advocated for for the vaccination, but again we offered our places of worship to be safe places that the government could use to vaccine the people. The churches, the mosques, the temples, and other religious places, became, or places where people could go and get vaccinated. I can say here, sometimes the government, had difficulties in convincing people to get the vaccine. But when we joined and offered ourselves and offered our places of worship, then it became easy. So it was both. Sorry?
No, that's an important message, I think, that you came together. And we'll come back to the Kenya situation in a minute. Let's broaden ourselves geographically and to some extent also with communities and hear from Rona Marungi how you see the issues of context in your own experience.
Excuse me. Good morning and good afternoon to you all. Thank you, Catherine. I'm grateful for the opportunity to be here. As introduced, I serve with World Relief on SCOPE COVID-19 project. SCOPE stands for Strengthening Community Health Outcomes Through Positive Engagement. It's a USAID funded program with 3 distinct projects across 6 countries. There's a SCOPE RMNCH, Reproductive, Maternal, Newborn and Child Health project, the SCOPE HIV, and then the SCOPE COVID project, which is what I oversee. On the question of context in which World Relief and SCOPE specifically are working with faith actors, at the core of World Relief's mission is to empower local faith communities to serve the most vulnerable. And so it's within that broad mission or context that World Relief's projects are designed and implemented, and that's certainly the case with SCOPE COVID. Of course, there's a lot of nuances and variations in the ways and the methods and the tools we use in engaging faith actors across different contexts. For example, the program models that are designed and used in Christian majority contexts will not readily apply to Christian minority contexts and such. Some of the issues that we are finding and encountering when working with faith actors at the moment, and just to highlight a couple, is at what level of faith actors, we are engaging in a country context. For example, is the engagement at national level or at a more grassroots local level. World Relief has historically concentrated on local grassroots faith leader engagement, but we're finding in recent times just more and more relevance and how vital it is to engage with national level faith actors as well to complement grassroots efforts. And this can play out in different ways, even at the grassroots level. In parts of Eastern DRC, for example, where we work, you find quite a number of faith communities and congregations are divided along tribal lines, which then becomes a context needing careful consideration in health program design and implementation. Another issue we consider even as basic as where faith actors are situated, whether it's in urban or rural or even peri-urban contexts. A quick example of how this is playing out in the SCOPE COVID project is that in the last 3 months or so, many sub-Saharan African countries have received large tranches of COVID-19 vaccines. And a lot of effort is being expended by actors involved in COVID-19 responses, from ministries of health to implementing partners like World Relief, to get these vaccines in people's arms before they expire, especially because often these vaccines arrive in these countries with very short shelf lives. And of course, there's varying levels of vaccine hesitancy. And I think you you may have read or heard of a recent study that has found that religious factors are the third most frequently cited reason for COVID-19 hesitancy globally. And so we're finding from some assessments that the Scope COVID project has conducted that some of the more caustic rumors or myths or misinformation that Reverend Muti was referring to, especially about COVID-19 vaccines, are being spread through social media, especially WhatsApp. And so you have faith leaders and communities in urban and peri-urban settings more prone to having their beliefs and decisions around vaccines driven by what they see on social media, since they have greater access to smartphones and the internet, whereas those in more rural settings are more susceptible to rumors and misinformation from leaders and others in their communities. And so realizing this then necessitates more context-specific modes of dispelling these rumors and mitigating vaccine hesitancy in these different faith communities for real impact. Something else, just really quickly, something as simple as getting advocates and vaccinators of the same faith or social and cultural background to be part of vaccination teams, for example, targeting specific faith communities, is making a big difference in places like Malawi, where World Relief is using various modalities in partnership with the Ministry of Health there to conduct vaccination campaigns. You find that Muslim health workers are providing, are just proving more effective vaccine administrators to Muslim communities than their counterparts of other faiths, for example. And I think this is applicable across various health service delivery mechanisms, including family planning modalities. So no COVID-19 response efforts can be successful without meaningful engagement of faith actors and communities. And in many ways, meaningful engagement translates to being very mindful and considerate of the context in which one is implementing.
That's a very superb capsule description of what it is we're talking about. So thank you very much. And let's cross the continent to Ali Kebe. I hope everyone has mastered the interpretation, because he will be speaking en français, in French. And I also remind you to look at the Q&A section if you have any questions. We will be coming to that in a short while. So, Monsieur Ali.
Hello, everybody. I wanted to thank you, all the panelists and all the participants who are listening to us. To go back to the question that has been asked, it's a question that is current. In the context we have now, it had an international impact. We were really not expecting that with COVID, especially in Africa. In Africa generally, it had a big impact. It's a great challenge. As we said, lots of leaders didn't want to see that COVID existed. It really hindered our activities. We were able to work with our leaders, with the health ministers, to organize awareness campaigns, especially push people to practice social distancing. In Mauritania, we have public transportation, we have groups. It was difficult for them to follow social distancing and to wear masks. We were able to play a role quite important regarding that through collaboration with the health department. I make people aware that has an impact on people. We closed the mosque for the first time in history. It was through COVID-19. We closed the mosque. People had a hard time to accept that. because we also had prayers. People were mobilizing. We were able to make the religious leaders aware. It was complicated for some. That they had time to accept that we were closing the mosque, even if there were restrictions from the authorities. Some people were very reticent regarding that. We are able to make them aware. Finally, the mosques were closed till September. We had to make people aware to respect social distancing, to say that the context of COVID had a great impact. It was not easy at all. Up to now, we're in the logic of making people aware, make them sensitive to the issue. They stopped all activities. We had awareness activities. We organized awareness activities. All that were stopped. We will get back to that more deeply.
Merci infiniment. Thank you, Ali, for again giving us some very graphic illustrations of the ways in which the COVID crisis is affecting communities and particularly in our case, family planning. So let's go back across the continent to Kenya again. And Father Joseph, if you can, you've given us some very vivid examples already of the way that COVID is having an impact on religious communities and a very positive vision of the collaboration among communities and with the government. Perhaps you can give us some more details, some more illustrations of both the positive, but even perhaps you can point us to some of the challenges. Kenya at one point had the highest population growth rate in human history, I remember. So there are remarkable achievements, but how far are those affected by the COVID crisis? What do you see coming next?
Thank you so much for this. Yes, it is true. We are going through a very challenging moment, both as faith actors, and for sure, when it comes to issues of family planning, we are seeing, the services are now getting back to normalcy, but with a lot of, caution because of, the infections. And as you know, we are advocating that everyone should be vaccinated so that, the provision of these services could be the health providers could be secure or safe as they administer some of these services to our people. To some extent, I would say that it is true. In history, we've progressed when it comes to issues of family planning. Initially, definitely, there was a challenge because we are coming. It's a moment of transition. When we had large families, a family of, a mother giving birth to even 18 children. But now we are seeing people, are very much concerned about, the importance of family planning when it comes to a healthy family, having children that you can manage, children that you can, are healthy. We've seen an increase in health that is, health, nutrition related diseases. There's an advancement in health. There's an advancement in, the lives of our mothers and the health of our mothers. There's a general understanding of the importance of family planning in the population. Although we call it, we are very careful on the terminologies that we use, because the local languages, if you translate, some of these locally, it may mean different. So we are very careful as religious leaders when we are engaging that we use the right language to guide We don't intend to kill. We don't intend to harm. We don't intend to do anything evil, but we are looking forward to a family, and a healthy community, and a healthy nation. So therefore, we're advocating that, people need to know their rights. People need to know what is available for them, that they can, the Bible, our Holy Scripture says, my people should live their lives in whole, So part of this is having good health. Part of it is having healthy children. Part of it is having, to live your life in whole, not having a lot of challenges.
Fantastic. Let's go to Rona. You have again highlighted this theme of adapting to context. Perhaps you could give us some illustrations from the curricula that you've developed. What are common themes, perhaps, but also areas where subtle attention to context is needed?
Yes, absolutely. So in April of last year, as the SCOPE COVID-19 project got underway, World Relief developed a set of health education materials specifically on COVID-19 vaccines for use in engaging faith leaders and faith communities, especially leaders, to empower them to be advocates in their communities and congregations for COVID-19 vaccines with factual information. These IEC materials are story-based and include lessons and teaching guides for Christian and Muslim and neutral faith contexts. There are also lessons for training, care groups and other community groups, and mainstreaming these COVID-19 messages for use in other health programming, including family planning, as well as sort of door-to-door household engagement. A set of illustrations also were developed alongside this curriculum, and those were then sent on to the base tools were sent to four countries where SCOPE COVID is being implemented, which is Kenya, Malawi, Rwanda, and DRC. And each country team then went through its own variation of an adaptation and contextualization process. This often took the form of a series of workshops where the teams engaged their respective ministries of health and other faith actors in taking these base tools and adapting them to the various country contexts, since each country has their own sort of COVID-19 response plans and realities and their own faith community landscape to consider. And the original set of illustrations as well also underwent multiple revisions for each country to contextualize them so they were country and often even region specific. What has emerged are a set of faith-based tools on COVID-19 messaging in all four countries that look radically different from each other when compared across countries, and to various degrees also different from the source material. And so in reflecting really briefly on our theme today, that context does indeed matter when engaging effectively with faith actors. There's just a couple of thoughts and reflections here. First, that having a base tool, in this case, that was generic enough to apply, to four disparate African countries, and still applicable, was massively helpful in that it provided just materials for each country to quickly adapt and refine to their specific needs and context, discarding what was not relevant and in many cases adding to the original tool. And this was important, especially in COVID-19 response programming that in some respects has been akin to emergency response work, with no time for each country to sort of go through its own original curriculum development process, if you will. Second, just the intentional involvement of key stakeholders in the contextualization process in each country has been absolutely crucial. Each country's involved the Ministry of Health staff significantly, as well as key faith leaders and diverse faith leaders, and other local stakeholders in their contextualization workshops and processes, which has led to a great deal of ownership across the board. And that these tools are now approved by the ministries of health, because a lot of ministries of health actually in Rwanda and in Kenya had indicated that they did not have any any IEC materials that they could point actors to regarding engaging faith actors when it came to COVID-19 messaging. And so these tools have become their sort of go-to in these cases. So yeah, that's been absolutely critical, and just a brief example there.
Those are fascinating stories. I hope that you develop those case studies, because I think they can be useful everywhere. And I'm also struck in all of your comments by how tightly the COVID experience is related both backwards and forwards to family planning. Ali, on parle beaucoup de dialogue.
Donc, Ali, on parle aussi de dialogue avec les jeunes.
Évidemment très fructueuse, mais
Pouvez-vous parler des défis posés?
Est-ce que vous pouvez peut-être
illustrations of the challenges that you've had working with youth groups, some of the challenges that you've overcome working with youth groups, Ali? Thank you. Yes. So the dialogues that we started with the community-based organizations have been a great experience, because in these contexts, we have been able to have interreligious dialogue. And as part of the Sahel Engage project, we have worked with 3 countries, Mauritania, Guinea, and we have done a number of meetings in close coordination throughout these countries. We had, as I said, imams. We also had Christian religious leaders and other religious leaders, and we had as well government representatives. So we had a cooperation and an interreligious, multi-sectorial dialogue going on. So we were able to take the different approaches, the different perspectives from these communities. And you know, sometimes we like to use big words and big concepts. So being able to propose things and have sometimes difference of opinion and have that discussion process to arrive at better solutions each time, to be challenged as different communities to think more clearly and more deeply into some of the issues that we were facing. So in the context of the Sahel Engage project, we were able to develop these tools, and they were based around four topics. Female genital mutilation, including also family planning and global health or basic health, engagement with the communities. So we were able to develop these themes through intercommunal dialogue and come up with tools, you know, especially for a sensitive topic like female genital mutilation, which is very prevalent in West Africa. In these workshops that we hosted and in these other community engagement sessions, they can be sensitive topics. So we sometimes encounter resistance. And when we had the leaders that we were able to engage, speaking directly with the communities, it is easier to make the communities understand. And when they see a united front that is multi-sectoral, it's easier to make headway into the communities and to enact true change. So it allowed us, these multi-sectoral and cross-sectional approach allowed us to have even greater success than we would have originally imagined. So there are many topics like the ones I've mentioned that are at the forefront of what's going on in West Africa. And the comprehensive approach we've developed over the last several years has allowed us to better create awareness across the community and be successful.
I think that's a fascinating story of both mutual learning, overcoming questions and difficulties and moving on. Well, we're moving now to some questions. We have 3 questions that have come in already. And the first one from Gatari Nidirangu Gichuhi, sorry, my pronunciation, really takes us to the most fundamental questions that we're addressing here, which is how faith communities engage with the broader efforts of family planning. So I think we'll end with that. But let's take Douglas Huber's question to Father Joseph. He's looking for some examples of language that's helpful in talking about family planning, and perhaps some language that might cause problems or that might be less helpful. So let's go to Father Joseph.
Thank you. Thank you for this question. It's important when we discuss issues family planning to be careful on the kind of words that we use. Some words can be misinterpreted to mean otherwise. When you're engaging the Muslim community, for example, and in our country we have the local languages, and the national language in Kenya is English and Swahili. So majority of our people would understand the local language, that is Swahili. There are some terms in Swahili that you would use and they will not augur well with the Muslim community. So you have to be careful. Are you talking of child spacing? Are you talking of limiting the number of children, in a family? Because that the community may be very bitter when you are telling them they are limiting their number of children. But when you are talking of spacing children for the health, because of the health of the mother, the health of the child, and also for economic purposes, it's easy to understand. So language is very, very important, not only to the Muslim, but also to the Christians. So sometimes when you are interpreting, it's important to understand the context where you are doing this, and the kind of people or the kind of their way of thinking, their understanding when it comes to their religion and tradition and practices. Thank you.
Great. We have another quite specific question, which relates to the links, and particular, I think, the focus on COVID, whether vaccinated people have been used effectively as spokespeople. So maybe in your final round of answers, you can address that. But let's start with Rona. I think we have, and the question from Gathari reflects this, that the objective is to see the faith dimensions, the faith communities and leaders as integral parts of the broader family planning within the context of each situation. So perhaps, Rona, you can step back and give us some sense of how would you optimize this engagement of faith leaders based on your experience? I'll put the same question to all 3 of you, which is likely to bring us closer to the end of our session.
Sure. A couple of ways we're seeing be effective for us in optimizing faith leader engagement across the board, not just in our COVID-19 response work, is one, faith leader dialogues have become crucial. Again, as I mentioned earlier, both at national level and at grassroots level. Those are 2 distinct levels of engagement, and really making sure that we're hitting both, and not sort of one-off dialogues, but consistent engagement and welcoming of faith actors in conversation to talk through issues. If where we've done an assessment and are finding that a lot of the vaccine hesitancy sort of factors in communities are religious based, which is the reality in a lot of these contexts, and a lot of them being promoted even by faith leaders. How can really getting to the core of what the issues are and addressing those has to start with dialogue and conversation and engagement. And that is going a long way for us, just consistent engagement with them. So not just sort of a one-off in and out type engagement, as well as just we're finding that long-term relationships with faith communities and faith actors has been very, very meaningful for us, especially with the COVID-19 response work that has needed to be sort of rolled out quickly, and for faith communities to be engaged very urgently and critically by nature of just the pandemic realities. The fact that World Relief has, years and years, because it's in our mission, has been cultivating relationships with faith actors consistently in various ways, has proven to be very, very meaningful and impactful because there's already sort of established trust. We've been with these communities, we've walked alongside these faith communities in many ways and through different issues and challenges. For example, in Haiti, where we're doing the SCOPE RMNCH work, we've walked alongside a lot of the Haitian faith communities for a long time. And so then when we come in with a COVID type conversation, however difficult it may be, and whatever they are hearing from social media or other places, there's an established trust and relationship to say, okay, we will listen, and we're willing to engage in dialogue and in conversation and think through these issues together, which is going such a long way in making progress, not just in the COVID conversations, but in family planning or other health conversations as well.
Ali, can you please comment about this conversation that we've been having on religious communities and how they can be good partners for implementing projects in the regions? So in the case of Mauritania, we have religious leaders who are very accessible and religious communities who are very ready to work with us in the context of Sahel Engage, in the context of Mauritania Engage. So we have open and ready partners in these religious leaders who are ready to cooperate with us, who are ready to cooperate with governmental authorities. So that is a real asset for us. And they help us with the awareness campaigns. And in addition to that broader group of religious leaders, I also have to admit that we have a group of religious leaders, a small one, who are a bit reticent, who are a bit resistant to work with us, and they have different ideas on many of these topics. So they can be problematic at times, that smaller group. And when we have to disseminate and create awareness campaigns and roll those out, we have to deal very specifically and very cautiously with those reticent religious leaders, and we have to find champions at the national level, and those champions at the national levels help us overcome some of the challenges and some of the challenges presented by those reticent religious leaders. There are also campaigns that we've rolled out where we try and expose those religious leaders who we believe to be more reticent or resistant to our programs, because they are disconnected somewhat with the reality of the communities, and they want to impose a different worldview. So we have to defend our cause as part of Sahel Engage, and we are in the process of constant evolution, constant iteration to see how we can deal with these smaller resistance groups and how we can leverage the assets that we have in leaders who are willing to openly discuss with us and partner with us. So another tool that we're using is social network to reach communities more directly and to advance the processes and the campaigns we have.
Ali has raised an important issue here, which is the divisions within religious communities, and specifically religious leaders who actively oppose, often misinterpreting or often with sincerity some of the fundamental principles that we follow in advancing family planning. Let's take that question perhaps, but also if we can bring in what Peter Moneni is asking, which is the practical fear that communities had in visiting clinics in Kenya. Perhaps Father Joseph, you can comment both on how you are dealing with people, religious leaders who have a very different perspective, but also some of the practical issues of linking the COVID pandemic with family planning.
Thank you. I know it's not an easy thing to have people think the same way. And that is how religious leaders are constituted. Sometimes it takes, a moment just to take them through and get them to understand what it exactly means on some of these service provision to the general public. And therefore, fear is always there. Fear is always there. And it has been there in many. But what we do and what we've tried to encourage ourselves is, let's come together and speak for the common good of the community. We don't rush. We go slow. We get to have everybody on board, because if someone or either of the communities differ with any of the other, then definitely we have challenges in disseminating the information and the care and the service that we want to see our people get. Mm-hmm. So practically, there is always a fear on things when people don't know exactly what it entails. But again, having to have them understand the meaning. In the recent past, they said, nothing for us without us. So having no one left behind in all these processes, working together with, because we have to bring everything to the open. Nothing is done, in secret. You have to bring everything and bring on board every other person when it comes to information. In the recent past, we've had a program where we are inviting the other to our religious places of worship. Christians are visiting the mosques. The Muslims are visiting the churches. We are visiting the temples. We want to have a community that is cohesive. Everyone, getting to know what are those fears. What do I fear in the Muslim community? What do I fear in the Christian community? What is this with the Hindu community in their temples? So we want to live in harmony. We want to understand each other, so that when we begin to roll out some of these, ideas, some of these services to our communities, we are reading from the same page. Thank you.
Yeah. Rona, you have, I think, a broad perspective. So perhaps you can address both of these questions. The first one really is dealing with the religious leaders who hold very different views, which may actively oppose family planning, and obviously now which can spread COVID misinformation or fears. And then the second is a more practical question of how far the COVID emergencies have disrupted family planning in different countries, and are there ways in which religious communities have been able to address those issues? And then I think, just to give you all warning, I'd like each of you to have a sort of 1 minute piece of advice, piece of wisdom as to where we go next before we approach the close. So, Rona.
Yes. Just to say to that second question that COVID has disrupted everything and everybody. No questions about it across the board. Again, I would hark back to something I highlighted earlier. Dialogue, in terms of just engaging, at least what we're seeing as working, engaging faith actors with disparate viewpoints, which is inherent and expected, and no way around it but through it, in terms of actually bringing them to the table and having various voices heard, and then working with them to address and get to some of the root causes, whatever concerns or issues those may be, for then effective engagement and participation of their various communities and congregants in family planning or COVID-19 responses or whatever the case may be. So yeah, that's just what I'll emphasize, that dialogues are what we're emphasizing, and different manner of dialogues facilitated in different ways. Perhaps they are interreligious, like those that Reverend Father Muti is championing very heavily in Kenya, for which actually our World Relief Kenya team participates heavily as well. Or country or denomination or even religious based. At the beginning of the pandemic, specifically in Rwanda, we conducted faith summits, but they were faith specific. So there was a Muslim faith summit, there was a Catholic, and different denomination sort of faith summits. And then after all these summits had been conducted and there was a lot of dialogue even within their own faith, we had the sort of interfaith summits as well, and brought everybody together in consistent engagement and conversation, which was meaningful and went a long way, because they had already sort of come together internally within their own respective groups, and then bringing everybody together across the board. So conversation and dialogue is what is proving very meaningful.
So dialogue, and nothing about us without us. Bringing to each of you 1 minute.
En commençant par Ali. Vos conseils. Ali, can you share your counsel in 1 minute, your wisdom on this fundamental question of how religious groups and religious partners can help us advance our agendas with the government? Thank you. So, as it relates to this specific question, we need to have leaders, we need to have partners at the religious level. And when we want to take our agenda and put our priorities to action, we have the most impact when we work with community partners. So it is important that religious leaders are able to have a partnership with civil society and also with government. The objective really is to formalize this structure. We want to formalize this structure of partnership between religious, civil society, and government, so that all of us can work together and maximize our impact, because the populations and the communities need us, and that is the essential point.
Excellent. Father Joseph, your final minute comment. You might also build on the wonderful examples you've given of interreligious cooperation, but also of cooperation with many parts of the government.
Thank you so very much. I know time may not be on our side, but I want to say here, religious leaders and faith communities are essential actors with a strong influence for positive or negative outcomes. I also want to say religious leaders and institutions have always partnered and collaborated with other stakeholders in addressing not only COVID-19, but matters health in various platforms. They continue to be committed in ensuring that their congregations are safe and protected. They also, I would also say that faith-based organizations and their leadership also have done a commendable job in their continuous efforts to promote interfaith understanding and peaceful coexistence. So therefore, it's important as we work towards achieving a healthy, a committed community. We consider, religious leaders and religious institutions as very, very key. Allow me to say here in Kenya, we are rated at 72% on public trust, and we thank God because it is service to humanity, service to God and humanity. Thank you.
That trust issue is important. Rona, one last quick comment.
Yeah, just to say, years back, I think we used to struggle significantly in having faith actors have a seat at the table. A lot of these engagements at government or with civil society, as Ali was referencing, but that is shifting and that is changing. And to what Reverend Father Muti was referencing there, no health response, I think, today can really have any meaningful impact if you exclude faith actor engagement and not bring them into the fold in very meaningful and intentional ways. So just to echo, I think, and sum up what we've been reiterating across the board in this conversation. Thank you, Catherine and everybody.
Well, thank you all so much. We've come to the end of our time, I'm afraid. And I think we have launched an important discussion that takes us beyond the generalities of nothing without us, about us without us, leave no one behind, some of the principles that we care about so deeply. So I think each of you has contributed vivid examples of your experience. I think we can not leave this discussion without an enhanced awareness of how much the COVID crisis has affected every part of our work, including family planning. So we will be sending around materials to everyone who participated or who registered, including the video recording of this discussion. And I personally look forward to pursuing the many important threads and pieces of wisdom, pieces of information that all of you have provided. So again, a warm thank you to you, and good morning, good afternoon, good evening to all of you in different parts of the world. And we will, I hope, continue the discussion. Thank you.
Thank you too.
Thank you.
Merci à vous.